Okay, good morning, good evening, doctors, nurses, and pharmacists. I am DrChe. Today, we will be discussing some important reading tips. Okay, just let me share the session with other doctors and nurses, and then we will continue. Okay, so any of you can just recap some tips for reading part A. Any of you can just recap some tips for reading part A.
Sir, first thing is that 1 to 7. Usually it will come from the text, and we have to just mention from which test it has come. The second thing is from 8 onwards, there is filling the blanks, and also it
Okay,
contains like 1 or 2 sentences from the text.
okay,
And we should carefully read the sentence, and no spelling mistake, because we have to copy from the text.
okay,
Yeah.
yeah.
And
What
it's
about
15 minutes
skimming and
time.
scanning? Yes,
Yeah,
15
skimming
minutes
and
is the
scan.
most important thing. What about skimming and scanning?
Skimming and scanning is important for that 1 to 7 questions, they say. But
Uh-huh.
I really don't know whether we should start from first 1 to 7, or we should skip 7 and then go to the 8.
So both are okay. Both use for some people. The first thing looks good. For other people, the second looks good. Okay. So
Okay,
it
okay.
depends. Okay. There is no fixed rule for this. So you can try both of them. You can try both of them and see which one okay fits better for you. Okay, Dr. Humayun, I have seen your comments in some group about PLAB, so just let me know if you need any help. Okay, with PLAB, okay. So here one of my students, he has passed OET. Okay, so this is important. But one of the most important thing in reading part A is that so you need to answer. Please mute, okay? Please mute. Please. Okay. So one of the most important things in reading part is that you need to answer 20 questions in 15 minutes. Okay. And if you believe me or not, reading part is the key to success. If you believe me or not, reading part A is the key to success. So if you get 20 out of 20 reading part A, hopefully you will pass your exam. Okay. If you get 19 out of 20, still it is possible to pass the exam. So please be careful. Okay, so take care of time management. Always take care of time management. So when you practice some reading questions, please try to take care of time management. Yes, Dr. Mohan thinks he got 20 out of 20, and then he passed reading. Okay, so it's important to get a good score in reading part A. It's very easy. Mostly the questions are very easy. Just you need to answer them quickly. Okay, and try to skim and scan and just quickly answer the main things. Okay, so today this is one of the samples. This is written by myself. Okay, so I have prepared this sample. So this is not none of you have done it before. So this would be a good practice today. Because mostly most of you keep practicing gestion files and some other PDF files. And this is something new for all of you. So here the topic is endotracheal tube, endotracheal intubation. This is the main topic. Then we have subtopics. Okay. So number A, text A. So we have 4 texts in text A. Okay, just let me share. It's very easy to share the session. For example, if you people can see this, the session is here. Just click on the share that would be at the end here. Okay. So just click share, then more options. I think you people can see my screen. Yeah, you can see more options, share to a group, and then you can share in groups related to the exam that you are taking. Okay, we need to be afraid of boss. You cannot take even name of the exam. You know, the reason is many of my groups were blocked by the boss. Okay, so it's very easy to share. Okay, just click on share, then more options, share to a group. For example, speaking partners is easy. Okay, so first text A, endotracheal intubation. I cannot. Okay, so in text A, this would be just intro. What is endotracheal tube and all of these things. So text A, endotracheal tube prevents from this and that. You don't need to read. Okay, you don't need to read it in detail, just main idea. Okay, and the necessity to to clear secretions and this and that is a common procedure, and ETT suction is a common procedure. Okay, intubated infants. Okay, minimal adverse effects types. Okay, so types, we need to know which meaning, how there is classification. Okay, so flexible tubes. Okay, number of different materials, these and that. Okay, then a number of sizes. So this is classification according to size. Okay, and have 2 or more channels. Okay, lumen. So this is classification according to lumen. Then we have text B, performing the procedure. This is the long test. You can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 bullet points. There are 11 bullet points. Can anybody tell me how you can quickly skim and scan? How you can quickly skim and scan? How you
Well,
can quickly
quickly,
see?
quickly
Yeah,
through
Subheadings we
the
can
key points.
yeah,
key
that is key
points.
points, but this is the procedure. Here you will not have any subheading this. So this is a procedure, and most of you, almost all of you are doctors or nurses. You already know a little bit about how is the procedure of inserting endotracheal tube. Okay, yes or no?
Yes, sir.
Yeah, at
Yes, sir.
least theoretically a little bit. Okay, but here you need to be careful. You need to see the main things. Okay, just so now I'm going to do this quickly. This is skimming and scanning. Okay, so you will see I will not take even 1 minute. So first wash hands mean this is just how to prepare before the procedure. Okay, just 1 minute. Just 1 minute break. I need to see a patient. I'm coming back. Okay. Okay. So can you hear me? Can you hear me now? No, I was just, seeing a patient, so that was why there was no voice. Okay. So first, wash hands. I don't need to read all. From this, I know that it means you are preparing before inserting. Okay. So this bullet point would be mostly preparing before inserting. Okay. Equipment check this and that. Okay. So then attach blade to battery. So means now you are preparing the equipment. Now here you are preparing yourself, preparing the equipment. This is oxygen. Okay. So at what rate, what percentage? Then you if you see here sedative opioids means no you are this part is about sedatives that need to decrease the pain while inserting this. Okay, so if appropriate we can give neuromuscular blockage also. Then now you are going to insert. Okay, so you have prepared yourself, you have prepared the equipment, you have given the attached the oxygen, you have given the sedatives in 2 points. Now you are going to insert. Okay, grasp with this hand. Okay, cross fingers and this and that, slowly insert. Okay, into this and that, and then tip of the curved blade should be placed in front of epiglottis. So they are details. Okay, lift the blade until the vocal cords, gently insert ETT and firmly hold. Okay, so this is how. Nothing is visible. I don't know why it is not
No, sir, it's visible.
visible. So if somebody cannot see, yes, you people need to try to check your connection, please. Okay. Okay. So I can see also on my Facebook. Okay. So next part is, okay. So next part is confirmation of endotracheal tube. Okay. So anybody can see without reading it. Any doctor mostly can tell me what would be in this bullet point, confirmation of endotracheal tube. Any doctor.
So it means that we have to check whether the tube is at right place or not.
At right place or not. Okay, very good, excellent. Okay, so here you can see the emergency intubation. Okay, blind procedures. Okay, to you visualized in larynx. If yes, do this. If no, do this. If there is circulatory arrest, no circulatory arrest. Okay, CO2. There is confirmation of clinical signs. Is position cuff 2 centimeter below cords or 4 centimeter above carina. Confirm the clinical signs. Tube and esophagus trachea. Resuscitate CO2, re-intubate. Okay, check position, X-ray this. Okay, re-intubate. So this is quick scheming that what I have done. Okay, when I will be giving the answers exactly, then I will see exactly. Okay, what I need in each. When I will get some exact question, then I will see read in. That is called extensive reading. Okay. So we have skimming, scanning, and extensive reading. Okay, extensive reading is, for example, if I think my answer is in here, in this part, so I will read this part thoroughly to get the answer. Then is the last bullet point. What are the risks of intubation? What do you think? What would be in this point without reading?
Complications.
Complications, yes, complications. Complications can be while inserting, complication can be after inserting. So these are mostly risks, you know, associated. So you don't need to read them thoroughly, just quickly, okay? Uh, if you read this, what would be your main point if you read this? Just vomit, blood, fluid, okay? Inhale. So main thing is inhale. So you may inhale any of these things. And next point, what is main point in this? What is the main point here? Anybody can tell me?
Main stem intubation.
Bronchial intubation.
Yeah,
Bronchial
the
intubation.
main thing is it may go down in bronchi. Okay, means it is, you know, it has gone away from where till what point we need to insert. Okay, so next is, if you see without reading esophagus, food point, and bullet point in the brackets, it means this is talking about esophagus. No, the tube is in an esophagus. Okay, a problem with esophagus. Okay, you don't need to read in detail. So if intubation does not work, healthcare providers may not be able to treat the person. No, what is the risk here? No treatment. If you cannot insert, no treatment. Okay. So if you cannot, if you cannot intubate, then you cannot treat the patient. So this is one of the complications also. People who have intubated may develop. So now this is infections. This is when you cannot insert. This is infections. Now next is, can anybody just point out what is the main point? Just main, don't read it complete. Okay. The next.
Vocal cord injury.
Okay, vocal cord
Complications.
injury. Okay, bleeding, swelling is no
Yeah.
problem with. Yeah,
Complications of
this is
endotracheal.
injury. I will say no, this is overall, but in this point only, this is just injury. Injury can be from mouth till airway, till vocal cords and below. Okay, it is injury, any kind of injury. So then we have a problem with recovery of anesthesia, and then we have if the problem is with lungs, they can collapse and these things. So these are your main points. Okay, so, but you need to do all of these things, quick skimming and scanning, in how much time? In how much time we should do quick skimming and scanning?
2 minutes, sir.
2
Maximum
minutes.
2 minutes. I will say 1 to 2 minutes. Okay, 1 to 2 minutes. If you spend more time, then you are wasting your time. Okay, if you are spending less than 1 minute, still you are wasting your time, because if you don't know the main points, you will not be able to answer the questions quickly. Okay, now let us start. So who can read the first question? Let me take Miss Nuna. Can you hear me?
Yes, doctor. Yes, doctor.
Okay, so first bullet point, can you read?
Verification of correct position of endotracheal tube.
So here, so what you need to do in this first 7 points is you just need to, in which text you can find the answer. So verification of correct position of endotracheal tube, in which text it is possible. All of you write in the chat, and people on Facebook write in the chat also. In which text it is possible? Just possible. You don't need to give the exact answer. Just possible. In which text is possible? No answer on Facebook, please. Why? Facebook, guys. Okay. See, okay. So now we need to go there. Verification of correct position of endotracheal tube. This is clear from the heading. Confirmation of endotracheal intubation. Verification of exact position of the endotracheal tube. You don't need to worry if you give B or D. Don't worry. You need to come here. You need to verify in which text it is possible. In text C, we are doing some procedure. We are doing X-ray. We are doing some clinical confirmation. Okay, so we are visualizing. So in text C is the answer. Okay, because here we just need to give answer. In which text you can find the answer. So Miss Luna, what is your answer? What is your answer?
Mine is text C, doctor.
Text C. Okay, because this is the main heading. Okay, So now I will take somebody else. Anybody else who wants to participate? Anybody else who wants to participate?
A.
Yes, please.
sir.
Okay. Okay. Any of you? So read the question number 2, please.
How to find an appropriate tube for a patient according to his or her needs?
Okay. Now, what comes in your mind? In which text it should be? You don't need to be accurate because we will go to that text. We will find where it is written there or not. Then we will go to another text. So in which text it is possible?
Sir, A.
In A?
Ji, sir.
Okay. So we have almost 38 people with us on Zoom and 10 people with us on Facebook. So if people on Facebook want to join us on Zoom, you can just get, added in my WhatsApp groups. Okay. So in A, now you will tell me. Let me make it a little bit smaller. So we have two parts. This is one part. This is also text A. So just tell me, you can find the answer here in this part or not? Somebody is saying text B also. Dr. Nadeem is saying the answer is in text B. Let us see. Can you find in these 3 paragraphs the answer?
No, sir.
No? Okay. Now in these 3 paragraphs, these one. Just write in the chat, okay? Don't tell me. If you find the answer, write in the chat. In which paragraph, which line. In which paragraph, which line. Okay, doctor who was participating or miss who was participating, what is the answer? Means where is the answer?
Sir, in paragraph number 2.
Paragraph number 2, where? Can you just tell us where is the answer?
Sir, in first 2 lines.
Huh? Okay, the answer is in this paragraph, paragraph number 2. Okay. Yeah. So by the way, it's not second line. I will not tell exactly, but this is not second line. Answer is in that paragraph, but is not second line. How to find appropriate tube for a patient according to his or her needs. Okay. So next is complications associated with endotracheal tube.
D.
Complications associated with endotracheal tube
D.
is D. Okay, very good. Because we know these are the just what are the risks. So just I'm using synonym of risks, complications. Okay. So you need to be careful. Why you are able to answer this quickly? Can anybody tell me why? Why you are able to answer quickly? Why?
Because of the risk.
Because no. Because you have done very good skimming and scanning at the start.
Yeah.
The reason is because you have done very good skimming and scanning at the start. That is why you can answer quickly. Otherwise, it was not easy. Okay. So, number 4th, trouble
B.
after giving a sedative. B. Okay. Okay. Good. Anybody else? D.
B.
B. D. What else? Anybody else? Okay. Dr. Siman Javed is very active on Facebook. Miss Rabia Tabassum is active on Facebook. Dr. or Miss Lily. And Miss or Dr. Java, something like that. Okay. Thank you, all of you, for being active on Facebook. Okay. So in which text is possible? D, B. Anybody else has any idea? D. So most of you are saying D. Let's go. So just tell me in which bullet point you can find the answer in D. The question is trouble after giving anesthesia sedative. And in which bullet point you can find the answer? Just be quickly, please. Second last, this one. Anybody else? Okay, anybody else? Any other opinion? Second last. Okay, so most of you are saying second last. Okay. Now I will see in the text B, because they were also talking about sedatives. Okay. If you remember well. Okay. Okay, the answer is D, text D, because here is the answer. Some people can confuse with this part, okay? Because here they are also talking about sedatives, okay? This is for ability to mask, manipulate. This is for clinical effect, okay? And trouble after giving a sedative. So trouble after could be, okay, emergencies, trouble waking, okay? This is waking up. I have a medical emergency. This is the trouble, okay? No, the question number 5, mostly you will get some questions would be very easy in first seven questions. Some questions would be very easy. So what do you about number 5? In which text?
A.
In which text is possible?
A.
A. Next time I will not do very good quick skimming and scanning. You people are very, cheaty people. When we do very good skimming and scanning, you people can answer easily. Okay, good. So where is the answer? Just tell me, where is the answer? If it is in A, where is the answer? The question is why people need an endotracheal tube. Where is the answer? Why? Where is the answer, please? If it is in text A, where is the answer? Can anybody talk with me?
Yes,
So what is the answer?
endotracheal tube suction is necessary to clear secretions and to maintain
Yeah,
airway.
it could be secretions, maintain and airway patency,
Yeah.
optimize oxygenation. So all of these things. So here is our refrax. Okay, prevents from these things. So answer is in text A, just at the start. Okay, very easy, by the way. Okay, when we should insert the tube again? In which text? When we should insert the tube again? A, C, where we can find the answer in which text? Okay, try to find the answer in C. Okay, this is C. So most of you are saying C. We'll go for C. Okay, just tell me where you can find the answer in A and in C.
It's just below the tube in esophagus. Re-intubate.
Okay, if I make it as a fill in the blank, if I make it as in fill in the blank, so what you will write? If I make it as fill in the blank, what you will write?
Tube in esophagus.
Tube in esophagus? Yes. If the tube is in esophagus, we need to re-intubate. Okay, this is also in esophagus. Very good, excellent people. A tube which provides O2 to left and right lung separately. What is this? In which text you can find information about a tube which provides O2 to left and right lungs separately? In which text? In which text you can find the answer? In which text you can find the answer? In A, okay. Let us go to A. Most of you are saying A. So just first tell me you can find the answer in these 3 paragraphs or not, okay? Then we will move to the next part. Question is very easy. A tube which provides oxygen to both lungs separately. Can you find the answer in first 3 paragraphs here? These one?
No.
No? Okay, then go to next these 3 paragraphs.
It's in the last para, known as double lumen.
There, wait, please. Wait. Just write in the chat, okay?
Yes. Last paragraph.
Last paragraph?
Yes.
What does this?
Any tube may have one or two channels within the tube, known as lumen. The double
Here is the answer,
tube
okay?
is often used as an
Yeah, good. So here is the answer. A double lemon tube is often used when it is necessary to ventilate each lung separately, such as in case of lung or other chest surgeries. Okay. Good. Okay. So now different type of questions. Now is fill in the blank. Okay. A specific type of infection that can be contracted as a result of ETT insertion. Fill in the blank. First tell me in which text you can find the answer. In which text you can find the answer. D, complications. Okay, good. So here is your question. This is your question. This is your text. Just tell me what is the answer. No, you need to fill in the blank, not only the text. Okay. So people on Zoom are very fast. I don't know why, but people on Facebook are a little bit slow. I don't know why. So
People who have intubation may develop infections such as sinus infection.
okay, very good. So once you have done the skimming and scanning, you know one of the bullet points is about infection. Okay, you need to go to that bullet point of infection. Okay, this is the bullet point of infection. Okay, read this bullet point thoroughly. People have develop infections such as sinus infection. Okay, a specific type of infection that can be contracted as a result of EDT. We can only write sinus or we can write sinus infection. Okay, both are okay. Okay, so next question. Which test is used to confirm the position of EDT tube when circulation of patient is not compromised? In which text you can find the answer? In which text? That will be, it depends. Okay, you need to try both the methods,
Yes,
both methods.
D.
Try method A,
Yes, C.
doing from 1 to 20 in order, and second method is try to do first 8, 9, 10, and then at the end do 1, 2, 3. So both of these are okay, but it would depend which is better for you. Okay, which method is better for you. Okay, just try both of them, see which is better for you. So in which test you can find the answer for this question? C.
C.
Okay. Okay, so this just read the question again. I will not copy there. Which test is used to confirm the position of EDT tube when circulation of the patient is not compromised? Okay, so this is your question. Now go to C. Okay, let me show you complete. Okay, this is the complete text C. Now give the answer, write the answer in the chat, please. Okay. Okay.
Square.
No, please, no, talk no, just in the chat. Okay, so we are confused. So we have 2 or 3 options. Just let us read the question again. Okay. Which test is used to confirm the position of EDT tube when circulation of the patient is not compromised? Okay, again. Okay,
The right laryngoscope.
Direct range scope. Okay, Dr. Amuna, very good. Please, people, be careful. The question says not clinical signs. The question says which test, okay? Which test? So they're talking about the test, not any clinical signs, not anything else. Test, okay? So the question is which test is used to confirm the position of ATT tube when circulation of the patient is not compromised, okay? So here circulatory arrest means circulation is compromised. Here it is not compromised, confirmed with clinical signs and CO2 detection. Okay. Some people, if you go a little bit, into depth of medical knowledge, you can say CO2 detection is a test. Okay. Okay. So if yes, tube and trachea, okay, check position with chest X-ray if possible. Use other maneuver. Okay. So I will go for chest X-ray. Some people can argue CO2 detection could be a test. Clinical science is not, CO2 detection. Some people can say it is a test, but I will go for chest X-ray. That is more appropriate, okay? Because the nurses, other people will not go into too much depth of this thing. That CO2 detection is a test, okay? Check position with the chest X-ray if possible. So I will go for chest X-ray. Say clinical signs, no, the main thing was to differentiate between, here it is written no circulatory arrest, then it is clinical signs. So clinical signs is not the answer because I'm asking for a test, not for any signs, okay? So I'm asking for a test. So a test would be X-ray here, X-ray. So the answer would be X-ray, the most appropriate answer. Can anybody read the next question? Yes, I am saying CO2 detection is a test, but don't worry, don't go into too much medical knowledge because for nurses, for other people, it would be not easy because it is written there clinical signs. I will accept both of them. CO2 detection is okay, X-ray is okay, both are okay for me, but most appropriate is X-ray. Okay, X-ray is most appropriate because even you can say confirm with clinical signs and CO2 detection. Even still, it is not the only clinical signs and CO2 detection. Here is the chest X-ray, that is the most appropriate. But I will accept both of you, CO2 detection and X-ray. But most, likely the better option is X-ray. Okay, go for X-ray. Okay, so anybody can read the next question? Yeah, X-ray is commonly used and is, it is clear from the reader. The reader wants you to differentiate between when you confirm with the clinical signs and test. Okay, so the examiner is using the word test. Okay, so go for X-ray is more appropriate. But I will not say CO2 detection is wrong because people will, argue a lot. So question number 10, anybody can read?
What can be damaged if endotracheal tube is inserted in the esophagus of a patient?
Okay,
Brain
good.
damage.
So that in which text you can find the answer? Go by step. In which text you can find the answer?
Text D. Text D.
D
D. Yeah.
delta.
Yeah.
Okay. Okay, so you will answer this question. This is the text D.
Bullet
Okay.
point number 3.
Yeah, bullet point number 3 is the brain. Okay. It makes, sometimes it makes sense. So trachea is there, tube is there. So how it can damage the brain? But the answer is brain. Okay.
Mm,
The reason is because it will not, the oxygen will not reach to the brain. So brain damage is the main thing. Okay, and not directly but indirectly brain damage. Okay, so answer is brain damage, brain. So the next question is, okay, so what should be done after injecting a medication for neuromuscular blockage? What should be done after that? Is fill in the blank. You need to fill in the blank. Okay.
Test B.
Text B. Very
Yeah.
good. Okay, try to find the answer, please. So what is the answer? Okay, write in the chat. Okay, don't tell me. Just please write in the chat. Okay. Dr. Simon Javed, you are very, Dr. Arnash, I'm not sure, but you are very active on Facebook. Thank you. Miss Dr. Siva Thapa, you are also very active. Thank you. Dr. Arnash Najava, Sylvie, Civil. Okay. You are also very active. Thank you on Facebook. And Miss Rabia Tabassum also. Thank you. So what is the answer to this question, people on Facebook? Looks very easy, but these are 20 questions. When you will spend time on these questions, it would be not easy to answer all of these questions in few minutes. Okay. Some of you might be thinking that it is very easy, sample and this. It is not easy. When you spend 15 minutes for all of these questions, this time would not be enough. Okay. You will not be able to answer all the questions. And when you're answering quickly, you will make mistakes. Okay. So here, some of you can go directly to grasp the because we have done administered neuromuscular blockage. So some of you can directly go to the grasp the laryngoscope in the left hand. Okay. But after that, we need to assess for clinical effect. Okay. So this is the answer. Assess for clinical effect. Okay. Below which part of body should we keep the tip of a straight blade to insert endotracheal tube? In which text?
B.
Just read the question again, please, so that we don't need to copy there. Below which part of body should we keep the tip of straight blade to insert endotracheal tube?
B.
Okay. So here is the text. Try to find the answer, please. Please mute. Whose is this? By the way, this is your question. Okay. This one is your question at the end. Okay. The last line. What is the answer? Please write in the chat. Miss Karen has joined us. Thank you. She says hello. Good. Okay, so what is the answer? Is fill in the blank. This is your question, okay? So we got one wrong question on Facebook. Very good. People on Zoom are very, I don't know why, but you people are very active and you give very good answers. Okay, but why on Facebook? We didn't get good answers. So what is the answer? Okay. Under is already written, you don't need to write below, okay? Below is already written, you don't need to write under, okay? So we have two, one is curved blade and other is a straight blade. Here we need to talk about the straight blade, okay? Straight blade. The taper straight blade should be placed under the epiglottis, okay? So the answer is epiglottis. Epiglottis is the answer, okay? Because here we're talking about straight blade, okay? So here we have two, so straight, insert the blade in the straight, in the right side. Okay, sorry. Curved blade is here and straight blade is here, okay? We're talking about straight blade in the question. Okay, the next question, okay. Apart from resuscitation, what else should be observed once the EGT is in patient's trachea? In which text you can find the answer? In which text you can find the answer? In which text you can find the answer? B or C or D, which part? Part C, okay. Just read the question again. Read the question again. About resuscitation, what else should be observed once the EGT is in patient's trachea, okay. So this is your C. Just try to find the answer. I have copied the question in the text in the chat. Okay, very good. Very good. Answer is monitor CO2. Okay. So if you see, the question was saying that, okay, apart from resuscitation, so resuscitate is already given. Okay. So resuscitate is also given. What should be observed once ETT is in patient's trachea? Okay. So tube and trachea, we have two at two places. So you need to see where is written resuscitation. There is no mention of resuscitation here in the second part. So they have mentioned about resuscitation in the first part, okay? So we have this CO2 monitoring, okay, good. Okay, What can lead to allergic reaction if a latex endotracheal tube is used? In which part you can find the answer? In which text?
B.
A,
B.
B,
A.
A. Okay. Try to find the answer here. This is your part A. You need to find the answer because this is fill in the blank. Okay. I have copied your question in the chat. This is your question. Okay. This is your question.
Silicon.
No, silicone is not the answer. Let us try to find somewhere else. I think there is no answer. Rubber? Latex allergy? I don't know because I have written this for a long time ago. What can lead to allergic reaction if a latex endotracheal tube is used? Okay. Okay, so what is the answer? Anybody was able to find the answer? Okay, nobody is able to find the answer. Different materials is wrong. Lattice allergy is wrong. Rubber is wrong. Okay. This is your question and this is the text, okay? This is your question and this is the text, okay? You need to find the answer in these 3 paragraphs, okay? Not nowhere else. Lumen no, poly no, PVC no. Who is Kiran Khan?
Yes, sir.
You are a doctor or a nurse?
No, sir, I'm a nurse.
You are a nurse, okay? So because Kiran is also one of my students. You are not the same.
Yes, sir.
You are one of my students.
Yes, sir, I'm your student. VIP hybrid
You
course.
have taken VIP hybrid writing course, okay?
Yes, sir.
Then I was going to offer you one free writing correction, but no, I can't offer because you are one of my students. You can send me letters anytime, get correction.
Okay.
Okay. So one free correction for you. Okay, so let us see. Anybody else who has given the answer latex first? So Ms. Kiran, when is your exam?
I'm planning for next month.
Okay, next month. I think I have one pending letter with me to mark.
Yes,
Yeah.
sir. Yes,
Okay,
sir.
just remind me. Sometimes I get lazy. You need to. So how many
Okay,
letters you
sir.
have sent me so far?
I think 17.
70. You have completed your 14 letters of the VIP hybrid course,
Yes, sir. Then
and now
after I
you are
sent 3.
yeah, you have sent 3. But how many you can send more till your exam?
Unlimited.
Okay. Do you need to pay extra?
No, sir.
No, no extra payment. Okay. Do you see any improvement? Do you see any
Yes,
improvement?
sir. Yes, sir. I
Okay.
made a lot of improvement.
Okay, good. Okay. So mostly I keep helping my students till their exam. Okay. So they don't need to pay extra. Okay. Because
Yes.
so the answer is latex. Okay. Here the answer is latex. What mean the thing? What mean the thing? Okay. What can lead to allergic reaction? Allergic reaction is already mentioned, allergy. So allergy is mentioned, means allergic reaction. Latex tube is mentioned. So what can lead to allergic reaction if a latex endotracheal tube is used? Okay, latex endotracheal tube, if used, okay, it is important to let your healthcare provider know if you have a latex allergy. So what can lead to allergic reaction if a latex tube is used? So here we will write as latex, okay, the material latex. It looks very silly question, yes? Yes or no?
Very silly.
Yeah, but believe me, real exam you will get some tricky questions like this because they will not give you all the questions straightforward. Okay, and they will not give you apart from PVC, rubber, what else can okay, what else material can we use? You will say silicone. No, no, no. So some questions will be also tricky. Okay, This is useless question, not useless. Believe me, DrChe. It's not useless. This is a real question. You will get some questions like this in the real exam. Okay. It looks useless. Okay, but it's not useless. Okay. There is answer in your text. Answer is latex. So what can lead to allergic reaction? Latex can just, okay, instead of what, just write in the sentence. Okay. Yeah, this is not difficult. This is not difficult, but in the exam, you will get the questions like this, believe me. Even in the practice, in the real practice tests, because there is answer. There is answer. This is a little bit tricky. You need to go somewhere else, because when you will read this, you will say, no, I cannot find the answer. Then you will go to this part, then you will go to this part, then you will go here, then you will go to this part, then you will go to this part. Okay. Then you will see that lattice is not mentioned anywhere else. Then you will come again to this part. Okay. Even now, if you can find the answer, what you have done, you have wasted 1 minute of your time. Okay. So now just replace, instead of what, just use latex. Okay. Read the sentence. Read the sentence, please. Anybody can read the sentence?
Latex can lead to allergic reaction if all latex intratracheal tube is used.
Is it wrong sentence?
Mm,
Is the correct sentence? Okay.
yeah,
Yes, it's a wonderful
but
sentence.
but it
Yeah,
make
believe me,
confused
you will
because
get some. You will be
It's a good
confused
example of
because
tricky question.
yeah.
they will not give you always straightforward questions. Straightforward question is like, for example, I will say, okay, what you should inform your healthcare provider about the material you are using, maybe like this, or maybe apart from PVC, rubber, what else you can use in the, in the, when making endotracheal tubes, you will say silicone. It's very easy. Okay. So please be careful. Okay. Yeah, the time, this is the main thing, is time. What you will do is, when you will read this question, believe me, what I did, because I have written this sample a long time ago. Okay. So when I did, okay, when I read this, this question is not here. The answer is not here. What should I do? Let us go to other place. So I have read in front of you. I have read all other, texts. There was no answer. There was no, latex. Then I thought, what, the answer is here, but what is the answer? Okay. Then I thought it is latex. Okay. So please be careful. These are the tricky questions. Okay. So, Dr. Nadeem, your question is good, because you are asking how much time we should spend. You should spend less than 1 minute on each question, 40 seconds, but you cannot just exactly say, I will spend 40 seconds. Sometimes you will get easy question like this, for example, verification of correct position is clear. Everybody knows this is in part C, okay? How to find appropriate size? You can just find a little bit where we can find the size, okay? Complication is very easy in part D. So to compensate this, because I cannot make very easy, because some of the questions are easy, so I need to give you some tricky questions also to check, to differentiate between, the students. Okay. So you will get some question very easy. You will just answer in 10 seconds. Sometimes you need to spend more than 1 minute. But at any time, if you get stuck in one of the questions, just leave it. Okay. Don't waste your time. Okay. So now let us mark 1 or 2 letters. Let us mark today Miss Kiran's letter. Okay. Now we need to disappear from Facebook. Just people on Zoom can continue. Okay.